Go.
Hi, Mr. Killian.
Hello.
My name is Julie Killian. I'm a student nurse. I'm here to talk to you about your visit to the hospital today.
Okay.
So how are you doing?
Okay.
What's going on?
I have chest pain.
When did your chest pain start?
Well, it's been off and on for about 3 days.
Okay, can you tell me a little bit more about the pain? Can you describe it?
Well, it's kind of like right over here on my right side, and it's sharp. When I move, if I go like this, it hurts.
Okay.
And then it sometimes goes down my right arm.
Your right arm, not your left arm.
Yep.
Okay. Let's talk a little bit about this pain you're having. So tell me, you're 40 years old? Is that correct?
41.
Okay. And I saw that Dr. took a look at your cardiogram, and your cardiogram looked okay. So I'm going to do your health history and just ask you a few questions. Are you comfortable with that?
Yes.
Okay. So you're 40 years old. History of any medical problems?
High blood pressure, I think.
Do you take your pills?
Well, sometimes.
So you are on medication for blood pressure?
Yeah, only when it gets high, I take some.
Okay. Any other medical problems? History of diabetes?
No.
Any kidney problems?
Nope.
Respiratory?
Nope.
Has anyone ever told you you had a heart attack before?
No, never.
Asthma?
Nothing like that.
Okay. Have you had any surgeries in the past?
No, I haven't had any surgeries.
No surgeries. Okay. Can you tell me any recent travel?
Nope, haven't got anywhere.
Okay.
Just stay here in Wilkes-Barre.
This pain that you're having, can you tell me, has there been any cough associated with it? Fever?
I have a little bit of a cough.
You do have a cough.
A little bit congested, I think.
History of any allergies? Seasonal allergies?
I'm allergic to sulfa.
Okay.
Sulfa drugs. And no, I don't know. I get sometimes congested when it comes to the change of seasons, I think.
Okay. So I'm going to review your drug allergies with you in a second, but I'm just going to go back for 1 minute to seasonal allergies.
Okay.
Molds, grasses.
Maybe grasses.
Okay.
Seems like in the spring I get pretty congested.
Okay. So we talked about your past medical history. Do you smoke?
Nope.
Okay. No history of smoking. Never?
Never.
Okay. Alcohol history?
Yeah, I like to drink occasionally, a couple here and there.
Okay. So would you say socially?
Well, maybe a little more than socially.
A few beers a day?
A few beers every other day, I would
Okay.
say.
All right. So
Who
we'll
doesn't?
Okay. Are you comfortable with the amount of alcohol that you drink?
Yes.
Do you have any problems with anybody questioning about your alcohol intake?
No.
Okay. When you do drink, do you get up the next day feeling okay? Do you feel like you can go to work,
Yes.
complete your normal activities of daily living?
Yes.
Okay, good. I want to ask you some questions maybe about your family history. Is your mom, is your dad, are they alive?
Yes.
Your parents are alive. Okay. Does your dad have any family? Does your dad have any history of any medical problems?
I think high blood pressure.
So high blood pressure runs in your family?
Yes.
Okay. Has your dad ever had a stroke? Any kind of heart issues, heart attack?
No.
Okay. All right. Any other family history with your dad?
No. This
Okay.
side's pretty good.
Okay. How about your mom? Tell me about your mom's side of the family. Any history with your mom or her family with
I think
stroke?
great grandfather had cancer, lung cancer from smoking.
Okay. Lung cancer from smoking?
Yes.
Okay. And your grandfather's deceased?
Yes.
Okay. Mom, is she on any medications? Anything that I should know about to help me today with your chest pain?
No, I think she takes blood pressure medicine too.
So that would be on both sides of the family,
Yes.
the high blood pressure. Okay. Have you had your blood pressure tested recently?
Just here.
Okay. How's it been running?
Well, it's a little high today, but maybe it's because I'm in the emergency room and a little nervous.
Nervous about coming to the
Yeah,
hospital?
maybe, yeah.
Okay. Feel free to relax. We're going to take good care of you. You seem a little anxious, but I want to let you know we're going to take good care of you. We're going to try to get to the bottom of the problem today and see if we can make you more comfortable. Now, I want to talk a little bit more about the pain. Have you noticed that the pain, anything makes the pain worse? Or did the pain start when you were doing anything? Was it a sudden onset? What can you tell me about when you noticed this pain and what associated symptoms you're noticing with it?
Well, I was lifting some boxes up the other day and it seemed like everything was okay, but then the next morning I started getting pain in that right side and stuff. So I didn't think anything of it, so I just continued to do what I was doing. So I went to work and I was still lifting boxes. And it made it worse. I was lifting the boxes.
Does your work include like laborious kind of work?
Yep.
Okay, so you do notice that when you lift, you feel the pain, and let me just correct me, on the right side of your chest.
I think it gets worse.
Lifting makes it worse.
Yeah.
Can you take a deep breath for me?
Yeah, it hurts. I do.
That does hurt. Do you mind? I just want to palpate your chest real quick. Are you comfortable with that?
Sure.
Okay. I'm just going to feel right here, and you tell me, do you start, when I bring into this chest muscle here,
that hurts.
I can pinpoint that?
Yeah.
It's tender when I touch there?
Mm-hmm.
Okay, I'm just going to have you bring your arm, raise your right arm. Can you feel the pain when you do that?
Yeah.
Okay, bring your arm down, and then maybe just bring your arm across.
It hurts.
You could feel the pain.
Yep.
Okay, all right. That helps me a lot. Can you tell me, have you taken anything for the pain? Have you tried any over-the-counter medications?
I tried some Motrin. Then I was at my mother's the other day, and she gave me a Flexeril.
Okay.
And then she gave me a Vicodin.
Okay. Did that help with your pain?
Yeah, it helps.
That's a few medications going on. Do you understand the medications that you tried?
Well, my mother says, "Here's I have these." She goes, "Try these. Maybe these will help."
Okay. So let me just go back one step. The Motrin that you took is an anti-inflammatory.
Right, I tried that first.
Okay, so once you took that, was the pain relieved?
A little tiny bit, not too much.
Okay, so when you took the Flexeril, which is a muscle relaxant,
yeah, that didn't help.
That didn't help. Okay, my concern with the Flexeril is you said you like to have some alcohol, okay?
Right.
So my concern is, you also mentioned Vicodin. Vicodin has Tylenol in it. So my concern is that